Checkup in Turkey. Once upon a time, I was asked if it's true that Turkey is great not only for spending good vacations, but also for a health checkups. So I recalled everything I know, compared hospital programs, and answered that yes, Turkey indeed offers the best price-quality ratio. And don't forget such a climate. In Turkey, comprehensive checkups cover heart, lung, liver, kidney exams, and many, many more tests. Different checkup programs exist for men and women, various ages. It may be cardiology and oncology checkups. In this video, we will show how a medical checkup is conducted in a Turkish hospital. Subscribe to our channel for we have plenty interesting videos about medicine for foreigners in Turkey. Why do foreigners choose Turkey for checkups? Well, because paradoxically, even in countries with advanced healthcare systems, it's usually very difficult for a person to find out about his or her real health status. If you get sick and have insurance, of course you'll be hospitalized and possibly even treated. But if you just want to check how you're doing, to ensure everything is fine and to catch any early stage diseases without symptoms, it turns out it's not so easy to do at home country. There you need to call, schedule an appointment, wait for tests in a long queue, and go on different days for various tests, which can take months. Here, on the other hand, you can complete a full checkup for different diseases in 1 or 2 days. Convenient. And don't forget the climate. After all, this is Turkey. Sun, sea, blooming trees, summer nearly year-round, lots of fun, interesting places. So, in general, it's a fantastic place to unwind. And while on vacation, it is very wise to take advantage of the occasion and the benefits of the local medical system. There is no fixed set of tests for checkups in Turkey. You should know that a checkup is a comprehensive service from hospitals. Each hospital has its own set of tests for a checkups, even if these checkups are named the same in different hospitals. For example, let's take a comprehensive checkup for men. One hospital may offer their 70 tests and another hospital 40. One checkup could cost $2,000, while another might be $700. They cater to different needs and budgets. One hospital might include tests for HIV and hepatitis C, while another may offer detailed biochemical and hormonal tests. And let's have in mind that sometimes similar checkups will have different names. These are just service titles, so you should compare and choose wisely, preferably with experts who know this market. Different hospitals have different checkups, but every hospital offers many options for men, women, under and over 40, oncology, cardiology, and children's checkups. You always have many options to choose. It's crucial to review the list of tests and analyses in each checkup. If you have no issues, then maybe it's enough to take a general checkup. If for some reason you want to focus a bit more on a specific area, like the abdomen for example, or heart, or tumor markers, then in some hospitals you can request additional tests. Typically, this is an add-on to the checkup. You can't get it separately. It's like at a car dealership. You can choose a car with a glass roof or without it, but you can't buy only the roof. We've talked about choice. Now, let's discuss the process. The checkup starts with a questionnaire. After that, patients are instructed on how to prepare for the checkup, what not to eat or drink, what to wear, and what activities to avoid before the examination, and are directed to different rooms. How does a patient feel in a new clinic?
It's not scary at all. Maybe only the signs in a foreign language. But there's no language barrier. They provided a translator immediately. And another great advantage is the absence of queues, unlike public clinics. No queues. I see this as a huge plus.
Doctors thoroughly question patients and send them for tests and analyses.
We have patients coming to us from different countries. Of course, we are pleased to welcome them and provide our services. We believe that by treating international patients, we enhance our expertise. Patients choose us for a reason. I hope that in the near future, we will implement even more advanced treatment methods, making our patients even more satisfied.
During a general checkup, samples of blood, urine, and stool are taken and sent to the lab. There, tests on these samples can number in the dozens. Typically, the examinations include ultrasound, CT, and MRI of central body regions. In some cases, images cover broader areas of a body. As the patient undergoes other examinations, doctors prepare a report on their findings, including echocardiograms and stress tests. Often, the checkup program includes exams by an eye doctor and a dentist. Women are sent for checks by a gynecologist and a mammologist, while men at special checkups visit a urologist and a proctologist. There are other differences in the list of tests for men and women. You can find this information in brochures, but without medical training, it's difficult to grasp what each test means. It's wise to go over the brochures with a specialist. Among the various checkups, you will definitely find separate programs for men and women before and after 40. This is due to the increased risk of certain diseases as we age. Typically, this involves the thyroid, women's breasts, and the prostate. Cancer problems also tend to arise more often after 40. The risk of these diseases is considered in checkups for various ages. You can find specific checkups for children in some hospitals. They are not so expensive and usually involve only a few tests to check overall health. But of course, as always, you can order an extra tests for your child. For many of us, a medical exam in another country is a very interesting experience. For at home, we know how hospitals work, and it's intriguing for many to see different methods. Also, the examination doesn't take much time but brings noticeable benefits.
As is well known, cardiovascular diseases are the most common cause of mortality for both men and women worldwide. That's why we place great importance on monitoring the cardiovascular system, especially in men over 40 and in women after menopause. It is very important to have a checkup once a year after the age of 40, especially for people with a family history of heart disease.
After the tests, Turkish doctors explain the results to the patient and give thorough recommendations. A translator will help translate the findings into the patient's language. If a problem is identified, doctors may suggest further examinations and even set up proper treatment. Many hospitals allow you to get a second opinion from another doctor, sometimes this option included in the checkup fee. The options depend on the hospital, and finding the best one isn't always simple. It's better if you have a local specialist on your side who understands the nuances of the Turkish healthcare system.
After a person submits a request for treatment in Turkey, we, the coordinating doctors of Healthy Turkey, select the best clinic and doctor for them based on their diagnosis, wishes, and needs. As practicing Turkish doctors, we know exactly how to do this as correctly, quickly, and effectively as possible. We constantly accompany the patient throughout the whole trip, and we always stay in touch for any questions that may arise even after the patient returns home.
I am impressed by the equipment, the attentiveness of the doctors, and the overall cleanliness and beauty of the clinic. And the best part is that I had so many tests done in just one day and received a thorough report. They explained everything about my condition, what to pay attention to, how to change my habits, and how to improve my diet. And of course, when to schedule the next examination. All of this was done in one visit.
Turkey is advantageous compared to other countries with its comprehensive patient care approach. In other countries, you often pay separately for each service. The organization of medical tourist visits to Turkey under the all-inclusive system is handled by Healthy Turkiye company, which works only with verified specialists. It manages all their activities for each patient in both medicine and hospitality. Healthy Turkiye takes care of all aspects, from consultations and agreements with clinics and doctors to transfers, lodging, immigration formalities, and medical document translations. You can see the company's website address on your screen. On this website, you can not only consult, but find information about other quality medical services in Turkey. We frequently talk about treating various conditions and serving medical tourists in Turkey. If you have questions about checkups, feel free to leave them in the comments under the video and subscribe to our medical tourism channel in Turkey.